Hello, hello, hello. Hi, I hope everyone's doing well. Good morning, good afternoon, good evening, whichever time this finds you. Okay, so in my video yesterday, I had said for people that have ALS or chronic diseases, if you had any symptoms, call your doctor. I've been in contact with different family members from around the country. I want to amend that a little bit and kind of tell you my history with dealing with pandemics and infectious disease and disasters. Um, okay, so I believe I mentioned that when I was younger, that fourth grade, the person that talked about yellow fever, probably from the Red Cross, it fascinated me. Infectious disease has always been something that kind of fascinated me. I'm a nerd that way. Read stories by the fire centers, virologists, bacteriologists, microbiologists, epidemiologists. I mean, it's really fascinating. It always fascinated me that something so tiny, microscopic, can actually kill you. The microbes versus Homo sapiens. Do you think about that? They are our predators. It's like you can wash your hands. You can prevent breathing in or fecal oral. You can prevent, definitely wash your hands after you go to the bathroom. Wash your hands before you put anything in your mouth. Always be clean because, it could be the lettuce. It could be 1,000 different things that you can get sick from. Most amazing thing about us is our body, our immune system can help prevent a lot of those diseases. So growing up, okay. As a kid, I had mumps. I had measles. I had one of those mothers that had the disease parties. Horrible. Bad idea. Don't do that. It's terrible. I have slight hearing loss because of it. Thanks, Mom. Went to nursing school when I chose to go through nursing school. It was probably more so after I had some high school friends. Several of my friends that were really sweet people. HIV/AIDS, that epidemic was going on in my teenage years. I saw friends, get Kaposi sarcoma, waste, get sick and die. I think about that network of friends. Only one person that was an ancillary person that I know is still alive. So I had friends that got sick and died. You really think about it, AIDS is a pandemic. It's basically people that are survivors of it lost lovers, lost friends, lost brothers, sisters. It's really sad. So I went to nursing school and we learned how to recap needles. I can tell you how long that is. We went, graduated, came back home, continued my degrees. I can remember one time I was sick and I think I might have had meningitis. I had a really stiff neck, high fever. I was okay. During my earlier career, the flus would go around. I remember one time I was picking up a little extra money doing a flu clinic, and I was in an outlying town, and I ran out of flu vaccine, and I swear the seniors would have hung me. They were so upset that I only had 200 doses. Couldn't help it. I worked for a company that the manager, I was asking if they could bring me more vaccine, said, "Do you have any saline?" I said, "No, I won't do that. That's, against the law. That's, ugh." So I didn't do that anymore. So I'm glad that they do it at pharmacies because I'm pretty sure the pharmacist will not give you something that's not right. That probably doesn't happen anywhere. I don't think any nurse would actually do that. That's wrong. So, I can remember late 90s, there were a couple influenzas that went around. There were a couple unnamed viruses that people got really sick from. The yearly RSV and influenza cases. MRSA came out, Staphylococcus aureus became resistant to methicillin. So bacterias, the new resistances, Endobacter, all the different ones, Pseudomonas that's multi-drug resistant Pseudomonas, remember one time I did an agency shift for a place that these people had all of these different bad bacteria. I think I donated my stethoscope to that place. I didn't burn those scrubs. So also disasters. I was a kid when Allison, that was Alicia, the hurricane. I can remember seeing a probably 100-year-old oak just picked up and tossed over. It was weird the way the tornadoes that came off from the hurricane, they destroyed one house, left 2 houses standing, destroyed the next 3. It's just odd, the power of Mother Nature. So 2000, we had Tropical Storm Allison. I can remember driving back from Austin to Texas and noticing the clouds were so dark. And then it started raining and didn't stop raining. I got a call saying, telling me that the water over my car at the time water was up to the windshield, and I said I had the keys in my car. There's no way I could leave. I was the only pediatric nurse that night. So 8 foot of water in my townhome, and you lose everything, you know. In that lesson, you know that it's not the cars, it's not the furniture, it's not the china, it's not that. You miss pictures, but it's not items that matter, it's people that matter. So eventually, build myself up when, it was Hurricane Katrina and Rita, the forgotten Hurricane Rita. When Katrina happened, we saw the country mismanage the disaster in New Orleans. You know, it's like I knew once there were shots at Charity Hospital that the response would be slowed down on the national level. So it's true. I mean, you know, you think about how we responded that way. People responded. Paramedics drove from California to come in and help. The border was closed from I-10. You know, I went around grabbing blankets, socks, shirts, all the things that you would need in case you lost everything, and some Vicks rub for the searchers. You know, bodies stink. You know, when it comes down to major disasters, it's at the local level, people banding together. Families, friends, you know, that's what's going to make the big difference in a disaster. Things do return to normal. Our infrastructure does return to normal. So I can remember I volunteered over at the Reliance Center, and a big stadium we have in Houston. And I'm a Texas, I'm not a Texas Ready nurse anymore because I have ALS, but I was a Texas Ready nurse. And I called to volunteer to help the evacuees, and they were going to place me with the CDC. And I was like, wow, the CDC. Of course, I was a little bit terrified. New Orleans had a higher level of tuberculosis. Hey, 25 plus years in healthcare, and I never tested positive for TB. Of course, I could go walk across the street, someone coughs, or kick up some dust, inhale it, and I've got it. You know, microbes versus Homo sapiens. Little tiny things, virus, bacteria, fungi, protozoa, little tiny things you can use a microscope to see can kill you. I mean, you know, they are our predators. So, anyways, ended up in crash trauma, did some basic things, you know, infection control, clean things, cover things. You know, I think we gave Alka-Seltzer. Yeah, that was my big experience. Yeah. So, we go, and Rita happened right afterwards. I was called, we need you to go here. It's like, no, I have to go to my own hospital. I sent my daughter out to West Texas, and with some family friends, and went to take care of patients there. I was in a far north. I can remember hearing the winds in the hospital stairwells. You know, we all camped together. You know, it was interesting getting through it. Thank goodness for generators. I was prepared. I battened down my house. I had stocked up. My cat was safe. um, Went home. Everything was okay after that. Later, due to some family, my daughter was injured, and for her to rehabilitate, I worked nights as a nurse for a long time. Went to West Texas so she could do that, and she could be watched while I worked. So invariably, while I was in West Texas around 2008 December, got some patients. I worked in a PCU step-down unit. Got some patients in, and they were influenza A, the flu. And it was weird. They started with diarrhea, fevers, and respiratory symptoms worsened, and some died. And I thought that was weird. More deaths than normal from the influenza. So I actually remember thinking, ooh, this is a hot virus. I looked on the CDC site, and they had all of the Texas or the United States-Mexico border in red for influenza A high levels. But well, with that virus, staff members started getting sick with it. There were different isolation protocols for influenza at that time, pre H1N1. Kind of like we don't recap needles anymore. So I can't remember, probably about a week and a half after that, I got H1N1, or the flu influenza. I was diagnosed with influenza A. I had to leave work during a shift. I got pulled to another unit, and the GI symptoms overwhelmed, and I developed a really high fever. And that sudden, onset of fatigue and muscle pain, malaise, happened. So I went home, and I was in the house, and I remember my mom checked on me, and my mom, the all-natural person, take your child to chickenpox and measles and mumps parties, wanted to call an ambulance, and I was like, no, everyone's sick, I'm holding fluids down, I'm urinating, I'm okay. So I used a separate bathroom and room from everyone else. I think my daughter brought me drinks and food, so she actually caught it. Kind of bad, when she was in high school at the time, and her high school had circular desks that people sat at, so all the kids that sat next to her caught the flu too. So yes, I was typhoid Mary without the typhoid. So, and that is one thing just for the SARS-2 COVID, COVID-19. There are reports of people attacking healthcare workers, being fearful of them. Now, when you see a healthcare worker in a store, they're usually not coming off work. They want to get those clothes that could be infective off as quick as they can. I used to strip in the garage. Front door. If I was around anything that was infectious, it wasn't going in my house. I never wore my nursing shoes inside my house. I would jump straight in the shower. Talk about hand washing? Yeah, hand washing. If I've ever gone to the store in scrubs, they are clean scrubs. Spraying people with Lysol, punching them. I mean, come on, folks. These are the people that are putting their lives on the line to save people from COVID-19. Have a little compassion, But regardless, with disasters, I think the one that, and I don't think that this is going to happen to this country because of COVID-19. If you guys remember hearing about Hurricane Harvey, that was Houston and Harris County and the state of Texas and Texans are used to having disasters, and everybody pulls themselves up by the bootstraps, and we put things back together. So with all the best preparations, that storm overwhelmed us. There was days, I was making sandbags, putting it outside my door and around my area for mold clothes. We didn't flood inside. It flooded everywhere, but I kept the water back. So, watching things, just trying to keep awake. My daughter's birthday was actually on the day Harvey hit. And I was proud that she got a birthday cake and she had ice cream. You know, she always is like, oh, my birthday got ruined by Hurricane Harvey. um, Family friends, little girl's birthday was yesterday. Oh, we can't have the party. Well, you know, she'll be in Emma's group. Can't have a party because of COVID-19 social distancing, isolation laws. You know, so poor kids. You know, the thing for kids is you want to get things as normal as possible on the track. You lead them. You show them how to react. So being panicky, being scared, you know, feeling out of control, you know, you can have those thoughts, but you have to display calmness and answer questions for kids. You know, you want to teach them to be survivors. So, you know, I was at triage nursing at that time, and I wasn't expecting to get a call. It rolled over, you know, from the weekend on into the Monday. And I got a call from, I was doing hospice at that time. I got a call from a family member of a patient that had 4 foot of water in the house. You know, 911 failed. The phone lines were overwhelmed. It was bad, you know. HPD, Harris County, sheriffs, you know, it was overwhelming, you know. There were so many people that were impacted. You know, I had to tell, you know, I had never thought in my life I would have to tell, as a nurse, somebody to please call the Coast Guard to evacuate. I mean, you know, that's something else. You know, that patient ended up being okay. Lived for a while long after that. You know, seeing other friends that were stuck on their cars, living in an area that's lower in downtown Houston, and having to, you know, coordinate, trying to give people numbers. You know, it's crazy, you know, crazy. It took a while, but things got back to normal. So even when, you know, how many feet of water can fall on you, you know, there are some people that died. And there's some people that got sick. Most of us survived. Now with the COVID-19, you know, I know that I live in a large, highly populated county and city, and I happen to be spoiled because the city I have has a city of hospitals within it, and we're actually, just south of it is the biocontainment unit that's designated for the 5-state area. There are a lot of medical institutions and schools and universities here. So when this virus is a pandemic and it's overwhelming, you know, you can see that the countries it's a hit have been overwhelmed, you know. Our government, CDC, they cut back on the CDC's funding for so long. You know, it's like things are expensive, and, you know, no one ever guesses, even though scientists have warned for years and years and years this could happen. And this isn't even the worst one that could happen. You know, the response, you know, people don't like to think of it. People don't like to talk about death. People don't like to talk about disease. People don't like talking about it, but it's something that everyone always has to prepare for. So in my previous video, I advised call your doctor. Now, if you're in a county that's smaller, in an area that's doesn't have the resources, the way the CDC works is that health officials and county and state officials, public health officials, will report to the CDC. The CDC bends to county and state authorities. So COVID-19 falls under the health department. Now, it depends on the area, where you are, the amount of tests. I have a family member that's out in the East Coast, and North Carolina. Apparently their state health department said they had 3 tests. You know, there are more people sick with COVID-19 than have been diagnosed with COVID-19. So if you're sick, if you have, strep, test negative for strep. You know, strep is going around now. You want to make sure, you know, you don't want rheumatic fever or, you know, a worsening of strep disease. Streptococcus aureus is a dangerous bacteria. It's a common one, but it can be bad, untreated. Influenza, if you swab negative for influenza, Tamiflu, can help if you catch it early enough. But if they don't have the COVID-19 tests, and those tests take about a week to get back, you can presume probably that you have the unknown virus, the mystery virus. If it's COVID-19, you have the fever, the dry cough. Some people have muscle pain. Some people have headaches. Some people have sore throats. Treat it as it is COVID-19. Isolate yourself. Call ahead before you go to an ER, urgent care, or if you ever have to call 911. Now, I hope that we would never have the issue of 911 being overwhelmed with COVID-19. If you have any questions, your state, I don't know which state you're in. I know on the West Coast there's a lot of 211. We have 311. I don't know. I mean, you can call and see if there's a state public health or your public health department, your city, your town, your county, and your state. You can call and ask if they have a nurse line, or you can look online. Hopefully they are free. There may be some fee with them too. It's sad, In America, we have to pay for all our health care. Though I guess we're not paying for COVID tests, but can you find one? If you are symptomatic and you have been seen, definitely if you're symptomatic, you want to be tested to make sure you don't have strep, to make sure you don't have influenza. There is not much they can do for COVID-19 right now. They're running tests on the Plaquenil, an old malaria drug. Who knows how much the supply is, a lot of RA patients and lupus patients were on Plaquenil. I don't know how much that supply is, and if it's anything like toilet paper or Clorox wipes, you have to get a doctor to order it. It's not something that you can just find. Good basic self-care and care. Keep things clean. Hand washing if you're sick. If you cough, if you sneeze, get a Kleenex, bin it. Or, sneeze, get it, throw it away, and wash your hands. If you're sick in bed, you can use hand sanitizer in between. But, anybody that's around someone like that, you can't just let somebody die. You just can't just let them be sick. You have to bring them fluid. You have to bring them food, Kleenex, check their temperature. It's like what they did in 1918. Some people catch it. Some people get really sick. Some people die. It's going to be one of those. We have to watch over our vulnerable. We have to watch over our weak. Even our healthcare professionals are running out of PPE. So if you're giving a nebulizer, that's when the worst, it aerosolizes it. You could probably put a bandana around your nose. There's no guarantee it's going to prevent it, if you're really worried. Just good hand washing and cleaning and disinfecting frequently touched objects. Use the dishwasher. You might throw a little cap full of bleach in the dishwasher too. Disinfect the bathrooms. Don't use the same bathroom as somebody that has symptoms of COVID-19. The virus is shed in the stool. You want to make sure that you get Lysol and bleach, or don't use them together. Don't use any ammonia products and Clorox together. You don't want to create any mustard gas. But you just want to keep things clean. The basic things that have happened since the beginning of time. What worked for leprosy? What works for influenza? What works for that? It's being clean. Those little microbes can be washed away. You just don't inhale them. Touch your face when you have been outside and you haven't washed your hands. And, keeping your surroundings clean and staying away from well people. Presume you're sick, so keep people away from you. Stay out of crowds. Now, there may be areas that aren't testing that may not want the numbers, if you're in that situation, you can't get, the area is overwhelmed, your doctor's not answering the phone, you send messages, you're not getting things, healthcare providers are going to be getting ill from this too. This is a novel virus. It doesn't divide between people, no matter what sex, age, ethnicity, country, viruses treat people equally. Bacteria treat people equally. So it can be hard. So you just call your doctor if that doesn't answer. Check your local news site. They may have some information. Check your local public health department. They may have recommendations. Check if they don't, you don't get any answers. Go up to the state and find out if there's a nurse line. Talk to somebody in public health. They'll give you good recommendations. But the best thing is to stay, in a self-isolation. If somebody's very sick, you want to check on them. If somebody develops shortness of breath that has COVID-19 like symptoms, if you want advanced health care, you want to call 911, but let them know the person has these symptoms before so the paramedics can protect themselves. Know that if this gets really bad, and it really could, it's not going to be bad forever, it's not going to end the world, but I know as an ALS patient, I'm going to know from my experience, as an ALS patient, if I'm sick and I would need to be intubated versus somebody that is 35 and is healthy and is that, or somebody that is 56 and doesn't have any other pre-existing conditions like me, there may come a time where they have to choose. And that's a scary thought, but it is when forgive the language, when the shit hits the fan, they have to make choices. So we know that we don't have a lot of, we have a lot of ventilators and a lot of hospital beds compared to other countries, but we have a lot more people. If there was a lack, our military may step in. There may be mass units. If people are, partying on the beaches for spring break, I wouldn't doubt that the National Guard doesn't get caught up and there's martial law like things. They might move in and close off communities. That close counties. That can happen. With Harvey, it happened. It wasn't martial law, but it was. We were under curfews, so I can see curfews happen. So just be careful. Make sure you have enough food in your house. Don't go being rude and grabbing toilet paper from people or getting into fights over milk or that. I mean, nothing worse than the savageness. We have to work together through this. And please support your healthcare workers. Remember, if you see them in scrubs, they're clean. They're probably coming in to get dinner. Most people that are in healthcare, I'm sorry, we wear pajamas to work most of the time. We don't have as many normal people clothes. So, I just hate that people are getting hurt, some places people are doing really nice and praying for them, giving them hugs, but just treat people kindly. Just stay 6 feet away from other people that aren't your family members, that you are not in contact with every day. Make sure that the vulnerable, the weak, and the sick, someone's watching over them and checking on them, okay? Wash your hands, cover your coughs, sneezes, catch them with a Kleenex or paper towel or napkin. Don't use the all precious toilet paper. No, I'm teasing, I'm joking. But stay safe. Eventually things are going to shake out and things will be normal, okay? We're just going to go through a little rough period. And take care of yourselves, take care of the ones you love, and I'll check back with you guys later. Thanks, bye.